I want to know how much it would cost to have eyelid surgery and to eliminate mannequin lines on both sides of my lips. Would this surgery also take care of dark eye circles? Who would you recommend in my area, and what is recovery time? I live in Fort Collins, Colorado.
Thank you for your question. You've submitted a single photo, a 3/4 view where you're smiling, and you're asking about eyelid surgery and addressing the mannequin lines, as well, and then about how much it would cost in your area. Well, just to get some perspective here, the fact that you sent a photo, submitted a photo with you smiling, does affect how we make an assessment of your situation. I'm a cosmetic oculofacial plastic surgeon, board certified by the American Board of Cosmetic Surgery, and I've been performing facial aging surgery for over 20 years. When we look at someone like yourself, who's concerned about the mannequin lines, or actually the term we use is marionette lines, and those are the lines from the corners of the mouth like a puppet. What we try to do is first get views of the face that are from the front and relaxed, and get some information from different angles, 3/4 views, side views. But I can share with you an opinion based on the initial impression. When I look at your face, and how I analyze faces in general, is I divide the face in upper third, middle third, and lower third. And for you, the concern is about dark circles under the eyes, but I would also bring to your attention that the upper eyelids also have hooding. And I always tell our patients that when you look at yourself, you may see the dark circles under your eyes as being significant. But when you step back and you get a more global view, puffiness under the eyes and hooding over the eyes can have a much more, has a much greater impact over your appearance. So I would probably have you consider an upper eyelid blepharoplasty. The lower eyelids, hard to say, because if there is puffiness, they're being pushed back by the smiling. And so but I would say that for a lower eyelid blepharoplasty, there's going to be a combination of some or variation of addressing the fat pockets, addressing the fine lines and wrinkles with laser, such as fractional CO2 laser, and the use of platelet-rich plasma. And this is derived from your own blood with the growth factors associated with wound healing that stimulates quality to the skin. Now, we won't go to the middle third, but rather to the lower third, since you brought my attention to the marionette lines. We have to understand what causes marionette lines. Well, understand that facial aging is a combination of volume loss and descent. Volume loss means loss of muscle, fat, bone. That's why the face gets smaller with aging. And then there's descent, sagging. In other words, the skin and the soft tissue support under the skin, called the SMAS, or superficial musculoaponeurotic system. It's a very complex term, but it is essentially the transfer vehicle between the muscles of the face to the skin, and this tissue sags. So when you're concerned about lines, remember, lines don't happen in isolation. I usually have my patients sit down with a mirror, and I'll actually vertically lift the skin, and I'll show them how those lines improve. Now, usually lifting doesn't improve the lines completely, but it makes a significant impact. A lot of times people try to soften these areas with filler, but I always explain that you can't put enough filler to, quote, push the tissue upward. And a lot of non-surgeons use the term lift when they're talking about fillers, when fillers don't actually lift. Fillers restore volume and can augment volume, but there's no way that a filler can push the skin upwards. So I think that you would be surprised to see, or not surprised to see, that when you do this, which is often referred to as the mirror lift, you'll see a significant improvement in the marionette lines. Now, in our practice, what we do is we try to counsel our patients, as to what is definitive and what we can do to buy time until they're ready. So, for example, in a situation like yours where I think it's safe to conclude that you'd probably be a good candidate for some kind of facelifting procedure, whether it's a facelift, face and neck lift, muscle, platysmal muscle plication, or I should say platysmoplasty. Those procedures are probably what's going to make the biggest impact, because for you at this stage of your life, there's a decent amount of dissent which can be addressed with lifting. Now, there are patients who come to us who say they're not quite ready, maybe because they have a lot of social engagements, maybe there's a lot of business or job-related issues, but they're going to do it maybe in a year. During that time, we can sometimes soften the marionette lines of the material, such as radius, and we have successfully helped soften. And of course, it's all about communication. If the patient understands what the limits are, and then we set expectations appropriately through this communication, then we can buy some time. So I think you need to meet with some qualified, experienced cosmetic surgeons. And to address the question of cost, if you're talking about surgery, remember, surgery is the cost of surgery is a combination of surgeon's fee, anesthesia, and facility costs. Where we practice in New York, there is a requirement that if you're doing any kind of sedation, that you are certified by a accrediting body. We're certified by the Joint Commission, the same people that certify hospitals and surgery centers. And with that investment comes a lot of safety. And so, which means that we have nurses, we have facilities that meet certain requirements. We have drills for emergencies. We have a lot of things that we do that ensure that our patients are secure when they come to our practice. Intrinsically, there is cost to that. But I will say that when it comes to safety, there's no cost that's too much. There was a recently closed large or significant sized company that was doing facelifting in large volume, but they weren't doing it necessarily in accredited facilities because they were doing everything under straight local anesthesia, and they would kind of bypass those requirements. And unfortunately, there were a lot of significant medical issues with patients that was well publicized. And so I always say that it is very important that you not just think about cost. There's always going to be someone willing to do something cheap, but you have never in your life gotten something cheap that was worth a lot. And so proper surgery in a proper facility with skilled personnel is very important for a successful outcome. So remember that you're investing in yourself, and learn about the costs that are right for your area, because these costs do vary by region. We're in Manhattan and Long Island, which are two fairly expensive places relative to the rest of the United States. So our costs are going to be different than your costs. So with that being said, again, meet with cosmetic surgeons, learn about these options, but I think that you would do very well from a broad overview with addressing your eyes with blepharoplasty and a face and neck lift when you're ready to do those things. So I hope that was helpful. I wish you the best of luck. And thank you for your question.